You're listening to the ATS Breathe Easy podcast, brought to you by the American Thoracic Society.
Welcome back to ATS Breathe Easy podcast. I'm your host, Dr. Ugo Ezema. I'm here on location at Orlando for ATS Conference 2026. Today's guest is Dr. Michelle Harkins. She's the Division Chief of Pulmonary and Critical Care and Sleep Medicine at the University of New Mexico and has been the lead voice talking about this Hantavirus outbreak. And I would like to welcome you to the show. Thank you.
Thanks for having me.
What was your initial thoughts when all of this started breaking out?
Well, I would say I was surprised. You don't think of hantavirus and cruise ship together. But I think we've been able to watch, we live in a global society, and we've been able to watch global health in real time, trying to help determine the outbreak and the source of the infection, and then to also then see in person-to-person transmission, because that was somewhat doubted in the literature, but now that has been out front and center for the world stage, unfortunately.
What are the different variants of the hantavirus, and how is this strain different from the others in the United States?
So there are about 40 hantaviruses around the world. Maybe 2022 actually can cause human infection, and they're rodent-borne, but they're found in bats and fish and reptiles and all over the world. And so the new world hantaviruses, which Nombre is in North America, it is very similar to the Andes virus in South America. There are about 11 subvariants of the Andes virus throughout South America. And those may cause human disease, but the Andes virus proper from Chile and Argentina has been the only one that has been documented to have person-to-person spread. So that's the main difference, but they're in the family of hantaviruses and cause a very similar disease in North America, the cardiopulmonary syndrome.
How much do we understand about that transmission dynamics for this particular virus that led to this outbreak?
So Andes virus most commonly is transmitted from interaction with rodents, but there have been sporadic transmission person to person over the last 3 decades, but very small numbers, 96, 1999, 2002, 2011, 2018, and now on this cruise ship. And what we understand from the prior work in Chile, looking at household exposures to people that had hantavirus and their families, as well as the New England Journal in 2020 that discussed the outbreak in 2018, it really involves very close contact with an individual that's acutely infected. So they have a fever, it's within the first 2 or 3 days of their infection, and close contact may increase the risk of developing or of spread. But we don't see this spread to numerous people, and we only see it sporadically when it's spread human to human. So it's still not as common, but it's the only one that can spread human to human. And it's, the current WHO is actually doing a study on this particular outbreak with 20 countries involved to look at the transmission pattern and really try to understand how is it transmitted person to person. Typically, we think it's people with high viral loads that are very sick, but it is based on the virus itself, the host response, and then the environment with which the transmission may occur.
You mentioned there had been previous outbreaks in the past. Why is this one unique? Is it just because we are much more aware as a society, or we have access to ongoings on and developing news? You think that contributes to why there's a lot more hysteria? Not to mention the impact of the COVID pandemic on our awareness for any opportunity for an outbreak.
Absolutely. I think that there have been sporadic cases, as mentioned, over time down in Argentina and in Chile, but isolated to those areas. And now we're actually on the world stage with a cruise ship, multinationality passengers. And so I think that, and then the COVID pandemic the hype of, oh my gosh, this is the next pandemic, which it is not, clearly. But I mean, I think there's the hype with that, as well as it's on the global stage, and you don't expect it on a cruise ship. I mean, that's just the other part that's so unusual about this, that someone brought it on, and then that person to person in the perfect storm, if you will, of being contained on a boat in close quarters, maybe on the inside portion, being exposed to the same people over and over.
With that in mind, especially on a cruise ship, what's our best accurate estimate of an incubation period for this particular virus?
So that really varies. The incubation period is usually 1 to 7 weeks. Yeah, so it can be a really long time, which is why there's such a focus to follow these people for at least 42 days after they get off the ship. The person-to-person outbreaks in the past in Argentina have a range from 9 to 40 days. Typically, though, most of the mean infection time duration from exposure was about 24 days, plus or minus 7. So 2 to 3 weeks is probably a good estimate, if not that 3-week mark.
Is there a confirmatory test, something that we can help to identify the presence of the virus?
Yes. So the best test, which is not widely available, is a reverse transcriptase RNA, right, to detect virus in the blood. That actually can detect virus 2 weeks prior to someone having symptom onset. But what is really commercially available are the IgM and IgG antibody testing. And typically, as someone is in that first stage of illness, they may have an IgM positive antibody. And then as they progress through the illness, they'll develop IgG positivity. You can have an ELISA test that is confirmatory based on the particular virus. And then the thing that we use actually in New Mexico prior to having any of these tests available, because the antibody tests are going to take 24 to 48 hours. There is a false positivity with IgM testing in general in the mainstream in the US, which is a problem. But we use a CBC, and we look for 5 things on the peripheral smear when someone comes to us at the University of New Mexico with hantavirus suspicion. And thrombocytopenia is going to be the first thing you may see in their prodromal phase. But to answer your question, confirmatory tests are IgM, IgG antibodies, and then the ELISA to the hantavirus antigen. And that's what's really more commercially available.
The world became very familiar with the phrase PPE. And of course, when the unexpected and predictable hysteria came around this particular hantavirus, should we get to that point, what is the proper PPE for this?
For the Andes virus, what is recommended, and it's not been done in a lot of the other outbreaks, just so you know, and it didn't have as many transmissions to healthcare providers. But what is currently recommended is kind of COVID era PPE, so an N95, goggles if you're doing some aerosolized, or eye protection, gowns, and gloves. We didn't do anything in particular in North America because ours is not person-to-person spread, but we've instituted let's do this more aggressive PPE just in case someone has the Andes variety.
The mortality rate for this is very, very high. Are there any research efforts that are out there or currently ongoing that is designed to help with prevention, detection, or potential treatment options?
So interestingly, in Chile for the Andes virus, they put a lot of money into research and national health programs, and they dropped their mortality by 30%, from 60% to 30%, with just increasing awareness for the public, increasing awareness for the providers, and taking appropriate measures to prevent exposure to mice. So the main thing is don't get exposed to rodents carrying hantavirus. Well, That's difficult, especially as we encroach in on the mouse environments. But doing things like rodent proofing your home, and if you go into enclosed areas and you see mouse droppings, open the doors, ventilate, allow time to have good ventilation, and then spray the droppings with a Lysol containing reagent and let it sit for 30 minutes. That'll kill the virus. And so really in Chile, they have done this. I think by disease awareness, developing diagnostic testing that we have now, earlier detection, and with that awareness, and then sending those patients that you are suspecting have hantavirus cardiopulmonary syndrome or the beginning stages to an ICU, and preferably one with ECMO capability should they progress into the full-blown disease.
So it sounds like essentially doing the very basics of what we already have capable and have accessible to us.
Absolutely, because there are no antivirals right now that are beneficial for the North American hantaviruses. Ribavirin has been used in Asia and in the European versions of the hantavirus, but that causes a totally different syndrome, a hemorrhagic fever renal syndrome. But they have not shown benefit in human studies here. What we hope to do at the University of New Mexico, we're doing a longitudinal study to understand the virus itself and how it affects the immune system. And our ultimate goal is to develop human monoclonal antibodies to treat the disease. But thus far, there are no specific treatments. It's about prevention, public health, and raising awareness.
There's been a sharp decline in public trust in health and medical institutions and professionals. What do you think communities like ATS and just providers at large, what can we do to help rebuild that trust, regain that trust, especially when you have essentially these mini outbreaks that can lead, and I actually think a lot of the hysteria stems from that distrust. So when you know an expert like yourself comes and says, guys, this happens and we have it under control, people are still making a big deal out of it in a way that feeds that hysteria. What can we do as a community, especially one like here at ATS, to help rebuild that trust and abate some of that mistrust?
Right. You are exactly right. And the pandemic fueled mistrust. And I think we just must speak up and speak out for science and really understanding and quickly dispel the myths. I think reinforcing the importance of public health and the reasons behind that, and perhaps, you know, ATS can be an example, and they can do podcasts like this and open it up to not members, but also to the public at large. So doing social media type engagements may be beneficial to really allow us to be on the forefront and speak for this. And you know, I also work with Project Echo, and I do a lot of telehealth things for providers for education, but we need to get actually into the public sphere to educate families and public figures, as well as the public at large, because there is that mistrust.
You were asked to be part of the repatriation steering committee for those who were exposed to hantavirus on the ships. What key factors did you balance for the travelers themselves and, of course, the general public whenever you were making your recommendations?
So yes, I was asked to be on the initial calls for how to treat hantavirus and what should they expect and what is the progression of disease from the Nebraska team as well as the Emory team. And, you know, we really discussed the importance of understanding what each person's risk was for developing infection, how close they were in proximity to index cases, to take a good history and to start to isolate and really observe with fever, you know, other history, other symptom monitoring, and that in general, they're going to Nebraska. They know what they're doing in the biocontainment unit, right? And so how do they assess the people? And then if they start to have symptoms, I just advised on don't overload with fluids, because that can tip people into that cardiopulmonary phase. Have ECMO availability, and that I could be available to answer other questions. But I think mainly just to prep, how to take care of these patients, keeping them isolated. And then, PCR is available to detect the virus 2 weeks prior to onset of symptoms, and if that would be a capability that they could employ.
What's the most reliable source out there for up-to-date information related to to public health and individual measures for preventing infection?
Well, the World Health Organization actually updates their website daily on this in particular, and every thing. And so the CDC has been a little behind in updating Hanta stats, but they actually have a really good section on prevention for rodent proofing your house and avoiding certain activities, or if you're going to do them, what precautions to take. And so there is valuable information on there. The New Mexico Department of Health constantly updates things. And then, the other thing that I'm doing currently is editing daily the up-to-date sections on Hantavirus in that particular thing. It's been a daily update. As soon as we learn something, we put something in there. But I think, having our organizations be able to have a page that either links to World Health Organization or CDC or other places with current information would be important.
What's something about this entire outbreak that you have reflected on that you haven't really said out loud that has really had an impact on you? What's something you reflected about this that's given you either pause for concern or pause for hope on the direction of public health moving forward?
So my initial concerns are, oh no, we're not part of the World Health Organization. But I will say that the CDC is doing things in the background, and I know they have been involved, which is great. And I think that this puts the actual, like I said, we live in a global society. And I think this has put global public health in the forefront of people's minds, and the cooperation that countries are working with each other under a guidance on how to appropriately protect the passengers and the society at large. I also, I didn't really ever think I would hear Hantavirus outbreak on a cruise ship because those are obviously ripe for other infections, but it just goes to show you're never going to know the answer. The virus they're going to keep coming, and this is going to keep happening in different venues. And so we have to really rely on public health measures and as a global society on the World Health Organization to organize such research, such clinical outbreaks. And so it's always going to be something.
Dr. Harkins, you are one of the few voices out there who can speak to this outbreak with experience in the lab and on the bedside, and of course from a public health perspective. I want to thank you so much for joining us, and looking forward to learning more about this as the developments happen. So I appreciate you coming on and joining us.
Thank you so much for the invitation. My pleasure.
Absolutely.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more ATS Breathe Easy podcasts on Transistor, YouTube, Apple Podcasts, and Spotify. Don't forget to like, comment, and subscribe so you never miss a show.